once again to our show In Our Teens, a show that brings together parents, teenagers, and professionals to help us understand the remarkable journey of teenage. आप हमें इतना अच्छा रिस्पॉन्स दे रहे हैं, उसके लिए आपका बहुत बहुत शुक्रिया। जब हमने इस शो के बारे में सोचा तो हमने ये सोचा कि जब हम गेस्ट चेयर में पेरेंट्स और टीनेजर्स को बुलाएंगे तो हम उनके एक्सपीरियंसेस के थ्रू, उनकी जर्नी के थ्रू, उनकी बॉन्डिंग के थ्रू ये जान पाएंगे कि कैसे पेरेंट्स अपने टीनेजर्स को मैनेज कर रहे हैं, कैसे टीनेजर्स अपने पेरेंट्स को ये बता पा रहे हैं कि अब हम चेंज हो रहे हैं, तो कहीं ना कहीं पेरेंटिंग का डिज़ाइन अब थोड़ा चेंज हो जाना चाहिए। साथ ही साथ हमने ये भी सोचा कि क्यों ना हम कुछ प्रोफेशनल्स को भी इनवाइट करें ताकि हमें एक परफेक्ट नॉलेज, एक स्टडी बेस्ड नॉलेज मिल सके। यही सोचकर आज हमने एक स्पेशल एपिसोड बनाया है। ये एपिसोड स्पेशली हमारे टीनेजर्स के लिए है जो हमेशा सुंदर दिखना चाहते हैं। वो चाहते हैं कि उनके सोशल मीडिया के पोस्ट हमेशा सुंदर दिखें। कॉस्मेटोलॉजी ये एक ऐसा फील्ड स्टडी है जहाँ पर स्टडी रिलेटेड टू ब्यूटी और पर्सनल केयर किया जाता है। टीनेज 13 to 19 ईयर्स ऑफ एज, इस दौरान बच्चे प्यूबर्टी हिट करते हैं और इस स्टेज में उन्हें काफ़ी नए प्रॉब्लम्स का सामना करना पड़ता है, जैसे एक्ने, पिगमेंटेशन, डैंड्रफ। कभी कभी ये सेल्फ मेडिकेशन कर लेते हैं या कभी कभी बच्चे इन्फ्लुएंसर्स की बातों में आकर अपने आप में रेमेडीज ट्राई करते हैं जो ऑफ्टन मेडिकली बैक नहीं होते। टू डिस्कस दिस इन माई चेयर टुडे इज डॉक्टर रूपाली वर्टी, मेडिकल डायरेक्टर एट प्यूरिटी एस्थेटिक्स एंड लेजर क्लिनिक। Cosmetologist and beauty science is her forte. In conversation with her today. Hi Doc and welcome to our show In Our Teens.
Glad to be here.
तुम्ही तुमच्या एवढ्या बिझी स्केड्यूलमधनं थोडा वेळ काढून आमच्यासाठी आलात. We really appreciate.
Well, you are doing a very noble thing, and I think giving the right message to the teens is very important. So I think my little contribution, if it helps in the long run, I would really like to do that.
Gratitude. ओके डॉक, सो सुरू करूया. जसं मी इंट्रोडक्शनमध्ये आपल्या ऑडियन्सना सांगितलं की तुम्ही एक कॉस्मेटॉलॉजिस्ट आहात, तर थोडं तुमच्या फील्ड स्टडीबद्दल काय सांगाल का?
So basically cosmetology or beauty science or aesthetic medicine, this deals about all the problems related to skin, hair, which has a cosmetic or a beauty type of problems, like you will have acne, pigmentation, dandruff, hair loss. So all these come under aesthetic medicine. So I practice like an aesthetic physician which deals with all these problems.
Okay. So doc, तुमच्या रोजच्या प्रॅक्टिसमध्ये किंवा ॲट क्लिनिक कुठले पेशंट सर्वात जास्त असतात?
टीनेजमध्ये सर्वात मोठा प्रॉब्लेम जो आहे तो ॲक्ने आहे. त्याच्यानंतर यू कॅन से पिगमेंटेशन, डॅन्ड्रफ. Then there are different types of pigmentation जे hormonal imbalance मुळे होतं, like acanthosis nigricans. So हे कॉमन आहे ज्याच्यासाठी मुलं येऊन कन्सल्ट करतात in our clinic. So acne would be the number one, I would say.
But doc, you know, when children turn into that teenage phase, get into the teenage phase, acne हा एक common problem असतो. Is it related? It is related to puberty, right?
So acne is a disease of the oil gland or sebum producing gland. त्याचं कारणं वेगळी असू शकतात. आता प्युबर्टीमध्ये काय होतात, खूप हॉर्मोनल चेंजेस होतात. सो दॅट कॅन बी अ ट्रिगर. आणि द मेन थिंग अबाउट ॲक्ने इज इट कॅन बी व्हेरी व्हेरी मेंटली स्ट्रेसफुल फॉर द चाइल्ड. ह्या वयात मुलं ऑलरेडी दे आर गोईंग थ्रू लॉट ऑफ अदर इमोशनल स्ट्रेसेस आणि हॉर्मोनल चेंजेस होतात. खूप त्यांच्या शरीरात चेंजेस होत असतात. त्याच्यात त्यांच्या चेहऱ्यावर जर ॲक्ने आहे, त्यांचा सेल्फ कॉन्फिडन्स खूप कमी होतो. सो हा एक अतिशय इम्पॉर्टंट मुद्दा आहे ज्याला आपण ॲड्रेस केलं पाहिजे किंवा पेरेंट्समध्ये अवेअरनेस असलं पाहिजे की तुम्ही मुलांना जर हा खूप सिव्हिअर प्रॉब्लेम असेल तर वेळच्या वेळी त्याच्यासाठी मदत घेतली पाहिजे. प्रत्येक ॲक्नेसाठी यू डोंट हॅव टू रन टू अ प्रोफेशनल, पण देर आर सर्टन टाईप्स ऑफ ॲक्ने जिकडे स्कारिंगमुळे ते हील होतात किंवा खूप सिव्हिअर ॲक्ने असेल, पिगमेंटेशन असेल, बॅक्टेरियल इन्फेक्शन असेल, तर तेव्हा आपले होममेड रेमेडीज ह्याच्यावर काम नाही करत, कारण त्याच्यामध्ये इन्फ्लमेशन असतं, इन्फेक्शन असतं. सो त्याच्यासाठी तुम्हाला प्रोफेशनल हेल्प घ्यायला लागते, कारण यू हॅव टू यूज स्पेसिफिक प्रॉडक्ट्स ऑर द राईट प्रॉडक्ट्स टू ट्रीट दिस प्रॉब्लेम.
पण डॉक्टर तुम्हाला असं वाटतं की पेरेंट्स हेजिटंट असतात मुलांना डॉक्टरकडे घेऊन जाण्यासाठी की ते स्वतःच उपाय करत राहतात?
सो देर इज अ ह्यूज स्पेक्ट्रम. काही पेरेंट्स एखादा ॲक्ने असेल तरी लवकर मुलांना घेऊन धावत येतात.
ओके.
बट देर आर क्वाईट अ फ्यू जे म्हणतात की अरे हे तर कॉमन आहे, तुझ्या वडिलांनाही होतं, तुझ्या आत्याला पण होतं वगैरे, पण हेरिडेटरी आहे. आणि त्या मुलाला एवढे सिव्हिअर ॲक्ने असतात की त्याच्यानंतर त्याच्या चेहऱ्यावर स्कार्स व्हायला लागतात, इन्फ्लमेशन व्हायला लागतात. तो मुलगा फ्रेंड्स बरोबर भेटायला जात नाही, पार्टीज अवॉइड करतो. स्पेशली इट्स नॉट ओनली गर्ल्स, बॉईजना सुद्धा तेवढाच प्रॉब्लेम होतो. सो देन दे आर टेलिंग की तू टूथपेस्ट लाव जाईल, किंवा they give some homemade remedies, but all these are myths. Severe acne will not be treated by all these things. You have to take professional help because there are specific treatments for it. आणि त्याच्याने मुलांना रिलीफ मिळतं. हॉर्मोनल चेंजेस असतात, त्यांच्या डाएटमुळे पण होऊ शकतं. सो वी काउन्सिल देम अबाउट दॅट ॲज वेल. हाऊ डू व्हॉट थिंग्स यू अवॉइड इन द डाएट. सो युजल मिसकन्सेप्शन काय, तू तळलेलं खातो म्हणून ॲक्ने. सो ॲक्ने इज नॉट बिकॉज ऑफ फ्राईड फूड. Acne can happen due to milk products or excessive sweets. So when we are treating acne, we are not only giving them products, we are helping them to modify their diet. We are teaching them about lifestyle changes because all these are a part of your hormonal changes. So हे सगळं त्यांना मुलांना बरोबर मार्गदर्शन मिळणं फार इम्पॉर्टंट असतं.
करेक्ट. मॅम तुम्ही घरातले नुसके बद्दल बोलला, टूथपेस्ट लावा. फार पूर्वी ना एक नुसका खूप ऐकण्यात यायचा की सकाळी उठल्या जी थुकी असते ती पिंपलला लावल्याने ते पिंपल जातं.
हो, अजूनही बरेचसे ॲडल्ट ऑनसेट ॲक्नेवाले येतात, ते पण पेशंट्स ते ट्राय करून येतात. पण देर इज नथिंग इन दॅट विच कॅन मेडिकली प्रूव्हन की विथ युअर सलाइवा दॅट ॲक्ने विल डिसअपिअर.
ओके. पण मॅम हे स्किन म्हणजे आर वी ऑल्सो इन्क्लुडिंग द हेअर पार्ट इन इट की म्हणजे स्कॅल्प तो सुद्धा आपल्या त्वचेचाच एक भाग आहे. तर कधी आपण म्हणतो ना अति डॅन्ड्रफ झाला त्याच्यामुळे एक बारीक पुरळ असा कपाळावर येतो. इज इट ऑल्सो अ पार्ट ऑफ इट?
येस. सो आता हॉर्मोनल चेंजेस जेव्हा होत असतात तेव्हा हॉर्मोन्सनी काय होतं, तुमचे ऑइल ग्लँड सिक्रिशन्स वाढतात.
करेक्ट.
अँड प्युबर्टीमध्ये द हॉर्मोन्स आर रेजिंग और सडनली लेवल्स वाढतात. सेकंड थिंग इज अराउंड प्युबर्टी और टीन टाइम तुमचे स्वेट ग्लँड्स सुद्धा मॅच्युअर होतात, विच हॅव नॉट मॅच्युअर टिल इन युअर चाइल्डहुड. सो ह्या सगळ्या गोष्टींमुळे सडनली यू स्टार्ट सीइंग खूप ऑइलीनेस आणि डॅन्ड्रफ. आता डॅन्ड्रफ म्हणजे नॉर्मली युअर स्किन शेड्स ओव्हर 2 to 3 or a week or 2 to 3 days. So normally that shedding is dandruff. पण काही टाइप्सची डॅन्ड्रफ असतात विच आर एक्सेसिव्ह. सो यू कॅन हॅव स्टिकी स्मेलिंग डॅन्ड्रफ और इची स्कॅल्प. सो दॅट इज कॉल्ड एज सेबोरिया और द इन्फ्लमेशन ऑफ ऑइल ग्लँड्स जे असतात त्याच्यामुळे झालेले डॅन्ड्रफ असतात. ह्याला तुम्हाला मेडिकल ट्रीटमेंट घ्यायला लागते. हे तुम्हाला नुसतं अँटी डॅन्ड्रफ शॅम्पू वापरून वगैरे हे जाणार नाही. आणि जेव्हा हा डॅन्ड्रफ पूर्ण स्कॅल्पमध्ये असतो त्याच्यामुळे तुम्ही म्हणाल्यासारखं कपाळावर पुरळ येतं और हेअर लाईनमध्ये यू हॅव डॅन्ड्रफ. बऱ्याचशा मुलांना पाठीवर ॲक्ने येतात और हँड्सवर ॲक्ने येतात. सो दिस इज बिकॉज ऑफ सेबोरिक डर्मटायटिस. डर्मटायटिस म्हणजे इन्फ्लमेशन ऑफ युअर स्किन. सो ह्याच्यासाठी यू हॅव टू टेक मेडिकल गायडन्स. सो वी हॅव स्पेसिफिक ट्रीटमेंट्स फॉर इट अँड ते ट्रीट केल्यावर दे इम्प्रूव्ह.
मॅम तुम्ही आता म्हणालात जसं ते ऑइल ग्लँड्स डेव्हलप होतात, स्वेट ग्लँड्स डेव्हलप होतात. इज इट द रिझन की अराउंड प्युबर्टी वेन गर्ल्स आर 12-13 years of age सडनली त्यांच्या डोक्यात उवा होतात? इज इट रिलेटेड टू दॅट स्मेल और
no.
Some changes?
Head lice is an infestation, parasitic infestation. आणि ते जर एखादा मूल कुठे दॅट इज बिकॉज ऑफ अनहायजेनिक. हे आता बरीचशी ही मुलं असतात ह्यांना सांभाळायला दे हॅव यु नो गर्ल्स और आउटसाइड हेल्प. आता ते जर इट्स इन्फेस्टेशन हॅपन्स वेन देर इज ओव्हर क्राउडिंग, अनहायजेनिक प्रॅक्टिसेस. त्याच्यात त्या मुलाला झालं की तो शाळेत जाऊन आणि 4 मुलांना देतो. Even I have had where the entire, so whenever we have a child with lice infestation, we treat the whole family. कारण एखादं जरी ते राहिलं पॅरासाइट और
परत होणार आहे,
द एंटायर फॅमिली नीड्स टू बी ट्रीटेड फॉर दॅट.
करेक्ट. एवढा विचार मॅम खरंच यू आर राईट अबाउट दिस. कारण की शाळेमध्ये मुलं जातात तर कोण कुठून इन्फेक्शन घेऊन येईल काही सांगता येत नाही. सो व्हॉट यू सेड इज राईट. ट्रीटिंग द एंटायर फॅमिली इज इम्पॉर्टंट. कारण एक जरी आलं की ते पुन्हा
येऊ शकतं,
सगळं वाढणार आहे. मॅम सो डॅन्ड्रफसाठी तुम्ही जे काय म्हणालात किंवा हे स्किन ऑइल जे जनरेट करते किंवा स्वेट ग्लॅन्ड्स, एक्सेसिव्ह स्वेट स्मेल येणं, स्वेट ओडर, ह्याच्यासाठी इज देअर अ सोल्युशन टू दिस की यू चेंज की तुमच्या डाएट किंवा ते म्हणतात खूप जास्त पाणी प्या म्हणजे स्वेट ओडर थोडा निघून जाईल. इज इट ट्रू?
सी तुमचा स्वेट जो असतो, स्वेट इज जस्ट वॉटर. ओके, इट डझंट हॅव स्मेल. द बॅक्टेरिया ऑन द स्किन गिव्स द स्मेल. दुसरी गोष्ट, तुम्ही जर अनहायजिनिक असता, तर त्या मुलांना ना आंघोळीचं खूप ॲलर्जी असते. बऱ्याचशे आई वडील म्हणतात ही तर आंघोळच करत नाही, हा आंघोळ करत नाही, असं
शाळेला सकाळी लेट झाला की तसेच चालले
आणि मग दिवसभर दे आर स्वेटिंग, दे प्ले आणि हे. सो स्मेल जो आहे, what you get for your sweat or anything, it is because of the bacteria on the skin. So keeping yourself clean is very important. I'm glad you brought this up, कारण दुसरी गोष्ट, बरेचसे लोक हे हाईड करायला they use these deos. त्या deosनी, because of the chemicals in the deodorants, we get lot of children with dark underarms or with contact dermatitis, कारण त्याच्यामध्ये जे केमिकल्स असतात त्याच्यामुळे स्किनमध्ये ॲलर्जीज, इन्फ्लमेशन्स होऊ शकतात. मग ते परफ्युम्स वापरतात. सो यू गेट दीज नॅचरल ऑर्गॅनिक डिओज विच डझंट हॅव मच केमिकल्स, सो दे हॅव टू शिफ्ट टू दॅट. दुसरी गोष्ट, परफ्युम्स कधीही डायरेक्ट स्किनवर परफ्यूम मारायचं नाही. यू नो वॉट आय टेल माय पेशंट्स, तुमचे जे कपडे तुम्ही घालणार आहात बेडवर ठेवा, त्याच्यावर परफ्यूम मारा अँड देन वेअर. सो यू आर रिड्युसिंग द केमिकल दिस थिंग, कॉन्टॅक्ट विथ युअर स्किन. So that is something which is very important. They can use a simple talcum powder. Talcum powder has hydrolyzed starch. Okay. So it keeps the area dry. Second thing is, because of wetness, they can have a lot of fungal infections in the underarms or hair. So त्यामुळे using a sadhi talcum powder, that would also help them in, you know, keeping the bad odor at bay. दूसरी गोष्ट is the sweat can smell even because of diet. Eating too much garlic or all that can also, you know, cause lot of body odor.
सो बेसिकली टीनेज फेज मध्ये आल्यानंतर एक लाईफस्टाईल चेंज, जसं तुम्ही सांगितलं, तेच एक फर्स्ट हेल्दी सोल्युशन आहे.
Yes. So, you know, see, teenage is such a turbulent phase. Lot of things are happening in their life. They have lot of studies, school, they have these emotional upheavals, and in this time their hormones are maturing. So a lot of body changes are happening and they don't know. So what is happening to them? You can have anger, you can have problems and all that. But nowadays what is happening, they have a lot of information out there. Correct. On the social media, on, you know, so getting information from the wrong source is causing more problems, because they're coming with a lot of complications because they have followed somebody who has given. There's a lot of unregulated information out there.
Cognitive overload chal raha hai.
So, you know, they'll say somebody, you know, who has so many followers said this, so I did it. But that has caused you allergic reaction, that has caused you a lot of inflammation in the skin. So what message that I would like to give is that they have to get it from the right medically sound this. So even if they are getting it from the social media, they should see that that person has the qualifications to give this advice.
Correct.
It should not be just depending on the number of followers.
आणि काही गोष्टी कोणाला सूट होतात, काही गोष्टी प्रत्येकाला सूट होईल असं नाही. मॅम, तुम्ही एक सेगमेंट आधी म्हणालात की केसामध्ये नॅचरल ऑइल ग्लँड्स असतात. सो आपण जेव्हा मग ऑइल करतो केस, सो इज इट युजफुल का स्कॅल्प इज कंडिशन टू टेक केअर ऑफ इटसेल्फ?
See, now oiling your hair is an age old. Like I remember when I was also a small kid, my grandmother used to oil her hair every week. That used to be a weekly program. But the truth about oil is a lubricant. Your hair is made up of calcium, hydrogen, oxygen. So there is no fats in your hair. Oil कशासाठी वापरता? If you have dry scalp, dry shaft of the hair, so it helps to moisturize or lubricate or give you that fats to your hair. For hair growth, oil doesn't work.
Okay.
Your hair root is below the skin. That is the living part of your. See, this is dead. When you cut, you don't get pain.
Yeah.
So you have to nourish the hair root. So they nourish karayla. When you massage, you are using oil as a lubricant.
Yes.
The massage movement helps in the blood circulation.
Okay.
That is what helps in hair growth. Okay. Now, oil per se, who should use? People who have extremely dry scalp or dry hair have to use oil but just 1 hour before bath is more than enough.
Okay.
If somebody has dandruff, which is sticky, oily, itchy, on that means what, your oil glands are hyper producing. In such patients, तुम्ही जर त्यांना खूप ऑइल लावलं, ओव्हरनाईट ठेवलं, they are going to land up with infections.
Yes.
They are going to land up with acne on the face.
Yes.
So oil shouldn't be used by everybody or for everybody or all kids in this. You can use once or twice a week, 1 hour before bath. Best oil, coconut oil, because the molecule size coconut oils is enough to penetrate into your hair shaft or your skin.
Acha.
So 1 hour before bath is more than enough. And खूप dandruff असेल, which is not dry powdery dandruff, that sticky dandruff, absolutely no oil application.
आणि कधी कधी एक्सेस ऑइल आपण जरी शॅम्पू केला पण काही ऑइल जर राहिलं तरी सुद्धा इट गिव्स यू दॅट स्मॉल पिंपल्स ऑन द फोरहेड.
हो, because see that blocks your oil glands.
Yes.
Because oil glands you're forming a coating. It
Correct.
is a occlusive. All these coconut oil they are occlusive. म्हणजे काय, they block your pores.
अच्छा.
So if you are putting excess oil and your pores are blocked, you're going to land up with infections.
Correct. मॅम आजकालची मुलं हेअर कलरिंग इज द न्यू इन. एक पर्पल स्ट्रीक, एक रेड स्ट्रीक. तर काय सांगाल तुम्ही हेअर कलरिंग बद्दल? कारण आपण जेव्हा सॅलॉनमध्ये जातो तेव्हा ते म्हणतात कोई बात नहीं, इसके ऊपर ये प्रोडक्ट लगा देंगे तो स्मूथनिंग हो जाएगा, डैमेज तो निकल ही जाएगा. So what is the truth behind it?
See, now all these girls want highlights. What you're talking about, coloring पेक्षा highlights करतात. If you have to put a highlight or that color, you have to understand, you break the entire bonding of your hair shaft and then you penetrate the color inside. So just think how damaging it is for your hair. Now they want to look good. What I would suggest is do on the ends, because you can cut them off. Always remember the living part is on the top. So don't put too much chemicals on your scalp or hair roots or anything like that. So बऱ्याच वेळा after that color wears off, they have hair which is dry,
lifeless.
Yes, they come and say, doctor मेरे बाल झाड़ू जैसे लग रहे हैं. But that is because you put and done so many chemical treatments. So these are damaging to your hair. Then they talk about these hair spas or they'll do this treatment that, but ultimately
it's already damaged.
It's already damaged.
त्याला किती मास्क लावला आणि किती स्पा केलं
तरी doesn't work. And you see, now they have to take care of their skin, hair and this, because once they become adults, so after 25 your aging process starts. So it's not in 30s and 40s as people think. So if they take good care during their teens and all, that will determine how their skin and hair will be when they hit your 30s, 40s, 50s.
Yeah, but rightly the way you said, doc, फॉर गुड स्किन अँड हेअर एक्सटर्नली तर काळजी घ्यायलाच हवी, पण इंटरनली डाएट सुद्धा त्याचप्रमाणे असावं. दॅट शुड लास्ट यू टिल युअर 50 years old.
Yes, so most important part for your skin, hair, anything is your diet and your lifestyle. In lifestyle, I would say exercise and sleep are also very, very important. Yes. In diet, you have to have a balanced diet. You have to avoid plastics. कारण हे सगळे जे प्लास्टिक मधनं you're doing microwave heating in the plastic or you're taking processed food, that is damaging all the hormones inside the body. So many girls at the age group मध्ये PCOS, polycystic ovarian syndrome, this is very, very common. Every other person, so they come up with acne, pigmentation, hair loss, but all these hormones are getting disrupted because of your diet and lifestyle. The girls are putting on too much weight, obesity, because at puberty anyways they put on weight. And if you're not careful about your diet or you're not doing proper exercise regime or routine, then you land up with obesity and the problems related to that, and then all the hormonal imbalances which come along with it.
So ma'am, with hormonal imbalances and not watching your diet leads to obesity. Can obesity in turn again lead to some skin problems and pigmentation?
Yes. So obesity मध्ये there is one type of pigmentation that I would like to mention. It is called as acanthosis nigricans. Many times the mothers get these children. They say, ये बहुत गंदा है, ये neck नहीं धो रहा है, काला काला हो गया है. So they try to scrub it. So this pigmentation is not because the child is unhygienic or anything. It's because of hormonal imbalance. It's called insulin resistance. So when they are obese, they have this condition where the excess sugars in your skin, they are glycated with the proteins. So त्याच्यामुळे ते black pigmentation. So they can have it on the neck, they can have it on the face. Many girls say perioral area, but this is very dark. They can have in their underarms, which can be dark. The groin area can be dark. So this is a type of pigmentation because of hormonal imbalance. And no matter how much you scrub with scrubs or anything, that pigment won't go. You have to treat the underlying cause, that is your obesity or the hormones, and we give certain vitamins and things to help reduce that.
Mom didn't know about this. I mean, the root of good health is your diet,
Yes.
is your exercise, is your sleep,
Exactly.
rather than creams and serums and makeup.
Yes. So sleep is so important. Why I would like to mention here, because I want the teenage people, see, they are all the time on their phones,
Yes.
or late night they are on the social media and all. Now you have to understand, you have a normal circadian rhythm. Why do we sleep only in the night? Why don't we sleep in the daytime? That is because there are certain hormones which are secreted at night when we sleep, like your growth hormone, which does repair regeneration. Now this is around in the, say, like 2 or 3 in the morning. If you are on social media, you are not sleeping, you won't have those processes happening in your body. So you have to have good 7 to 8 hours adequate sleep to see that your hormones are functioning properly.
Correct. Now, in bed, scrolling of reels.
That
Keeps
will
you-
see what happens if you are on some, you say like your phone, or you're watching some serial or something. That destroys your melatonin, which is your sleep hormone.
Yes.
So then you see you won't fall asleep very fast. Then you're awake till late night trying to sleep and all. So this will disrupt your sleep. So when you're sleeping, you have to keep away from devices.
Yeah.
The bright light in the devices, it breaks down your melatonin hormone, which is a sleep hormone. So
And
it's
also
very-
the eyes go
Yes.
for a toss.
And another thing that is there when we talk about sunscreen, so there is radiation from these devices. So now everybody's talking of the blue light radiation, which can also cause aging process in your skin or certain other problems.
Oh, I didn't know this, dog. Please tell us more
So
about this.
basically when
Because we always thought की सनस्क्रीन आपल्याला सनलाईट मध्ये आपण काळे होऊ नये म्हणून लावायचे, but I didn't know की डिव्हाइसेसच्या लाईटनी सुद्धा
Okay,
it can
so
affect the skin.
See, the thing about sunscreens is it's a very, very important component in your skincare to prevent aging, as you rightly said. Now, aging can happen because of the ultraviolet radiation. What you feel in the sun, the heat is infrared.
Correct.
So you can have UV radiation on a cloudy day, rainy day. You can have infrared radiation even when you are cooking in front of gas or in front of devices. So all this light is damaging to your skin. So using a correct broad spectrum sunscreen, which has prevention against all ultraviolet A, B, and your blue light,
Okay.
that goes a long way in protecting your skin. So for this, see, every day now in certain schools sunscreens are banned. So what I would tell the parents, that when you're taking your children for beach holidays or this, see to it that their skin is protected. Or when they are traveling, like sunscreen has to be put between 9 to 4 or 5. That
Correct.
time it is 9 a.m. to 5 a.m. because that is the time the ultraviolet radiation is maximum. So it's a very important component of skincare. But I have seen that certain schools are banning sunscreen, or if the child is putting sunscreen and coming, they send them home.
Yeah. Is it?
Yes.
कारण का ते चिकट त्यांना असं वाटतं काहीतरी मेकअप लावून आलं.
Makeup lawn. So there is like a no makeup policy in school. So even sunscreen is a banned ingredient. So I think it's an important thing, especially if a child is having acne and we give certain creams in the night to help. So morning you have to protect with the
Yes,
sunscreen.
because
So-
skin खूप delicate होऊन जाते.
Yes, so I have had to give letters saying that please allow
Yeah,
this
allow.
child because they are under treatment for the same.
सो मॅम हे सनस्क्रीन बद्दल तुम्ही जे बोलला त्याच्यामध्ये सुद्धा काय खूप व्हेरिएशन्स आहेत ना, SPF 15, SPF. So what is the best sunscreen for our Indian climate that you would suggest to our teenagers?
Okay, so sunscreen has two things. One is the filters which protect and how they protect. Okay, you have two types of physical sunscreen and chemical. Physical sunscreen म्हणजे काय? It just blocks the ultraviolet radiation. Very little penetrates into your skin. And the chemical sunscreens are the ones which will allow the rays to penetrate, but they will repair and prevent the damage due to that.
Correct.
Now, chemical sunscreens is something which teenagers should not use. Most of these chemicals are hormone disruptors. So these girls can have problems in their hormones because of repeated use or absorption. So physical blockers, these will have zinc oxide, titanium dioxide. These are the best sunscreen to use. Where your SPF is concerned, it is called as sun protection factor. So for Indian skin, the study is that anything above 15 or 30 is 20 to 30 is okay. So what it basically means is how long you can be exposed to sun without getting burned.
Yes.
We already have melanin pigment, which is a protective pigment in our body. So any sunscreen which is say 25, 30 and above is good for Indian skin.
Okay.
Way you apply the sunscreen is also important. You need to put around one entire finger unit or 50 paise coin quantity.
Okay.
Because it is said that 2 gram per centimeter square to cover your face and neck. You have to apply sunscreen 10 to 15 minutes before you step out in the sun. That is mainly with the this thing, because the protection starts after that time. So you can't immediately put and go out. We are in a humid place, or children who are swimming and all, they have to use a water resistant sunscreen.
Okay.
Or you're on
Yes.
if you're on a beach holiday, the water bodies or snow, there is double radiation. So you need to reapply the sunscreen after 4 to 6 hours to give you adequate protection, because when you sweat, the protection is diminished.
Okay.
So
मॅम थोड्या वेळापूर्वी तुम्ही म्हणालात की ते इन्सुलिन लेवल्समुळे, ओबेसिटीमुळे ब्लॅक पॅचेस वगैरे येतात. नुकताच एक सोशल मीडिया, मॅम सॉरी डोंट माइंड, बट मला हे बोलायचं होतं की सोशल मीडिया रीलमध्ये मी बघितलं की त्यांनी दाखवलं की मानेवर तो ब्लॅक पॅच आहे, आणि मग त्या इन्फ्लुएन्सरनी टूथपेस्ट आणि बेकिंग सोडा मिक्स केला आणि मग ते लावलं आणि मग ते एका कापडाने पुसलं आणि मग ते एकदम स्वच्छ होतं.
So see, these are all misleading videos, because असं बेकिंग सोडा लावून किंवा टूथपेस्ट लावून तुमचं पिगमेंटेशन जात नाही. You have to treat the root cause, आणि there are specific creams with certain concentration जे लावून आपण जे वरचं सुपरफिशियल पिगमेंट असतं ते काढतो. पण जोपर्यंत तुम्ही इंटरनली चेंजेस आणत नाही, ते इन्शुलिन रेझिस्टन्स जेव्हा आपण ट्रीट करत नाही तोपर्यंत हे पिगमेंटेशन जात नाही. सो तुम्हाला दोन्ही करायला पाहिजे. पण आम्ही डिपिगमेंटिंग क्रीम्स किंवा स्किन लाईटनिंग क्रीम्स जे देतो, दे आर विथ प्रॉपर कॉन्सन्ट्रेशन ॲन्ड ऑल, अँड ओव्हर अ टाईम पिरियड दे ब्रिंग द रिझल्ट. असं इन्स्टंटली बेकिंग सोडा लावून काहीही जात नाही. सो दॅट्स अ मिसलिडिंग व्हिडिओ, आय वुड से.
सो मॅम, ॲज अ प्रोफेशनल तुम्हाला इन्फ्लुएन्सर्सना आणि जे इन्फ्लुएन्स्ड होतात या दोन्ही पार्टीजना काय सांगावं असं वाटतं?
सी, हा आता खूप मोठा प्रश्न आहे. आता ह्या बऱ्याचशा या टीनेजच्या मुली माझ्याकडे येतात विथ लॉट ऑफ स्किन प्रॉब्लेम्स लाईक कॉन्टॅक्ट डर्मटायटिस, ॲक्ने फ्लेअर अप, रेड पॅचेस. हे सगळं कशासाठी होतं? दे से डॉग, वी आर इन्फ्लुएन्सर्स, आम्हाला फ्री सॅम्पल्स येतात प्रॉडक्टचे, ते आम्हाला वापरलंच पाहिजे बिकॉज वी आर पेड फॉर इट. सो देर इज अ लॉट ऑफ प्रेशर ऑन देम टू मेंटेन दॅट पेज or that thing. So what I would say is that do not fall prey for all these things. Take care of your skin. When you are using any skincare product, see, everybody's skin is not different. Mansi, your skin is different, my skin is different. So why we as medical professionals or cosmetologists, because we match the right products. See, there are so many products out there. If you go to a chemist, the chemist will say, ye laga, wo. But we understand your skin. Do you have a combination skin? Do you have a oily skin? Do you have a dry skin? And we prescribe the right products, because the market is flooded with so many products and not all of them are good, or not all of them are of the right quality. Now take makeup, because these girls are using so much makeup. So you have to understand. Take a simple lipstick. So what is there? Lipstick has artificial colors. Lipstick has chemicals in it, and so they are loaded with lead, arsenic and all these heavy metals. So every day you are using a lipstick and that is getting absorbed in your body. You can have heavy metal toxicity. There are so many preservatives which are added which can have problems. See, now around the lip area you have mucosa. Mucosa म्हणजे काय? पातळ असते skin. So everything gets absorbed faster
quickly
into your skin. So if you are using a I would say not a quality product, see, which is not regulated. It's not about the costing, it's about the right company or the right testing judges झालेले. If you're using like these chemical products, they are going to cause problems to you. So they'll end up with dark lips, मग त्यांना ते लपवायला परत दे हॅव टू कीप पुटिंग लिपस्टिक, दे लँड अप विथ चिलाइटिस म्हणजे क्रॅक्स ऑन द दिस और swollen lips. So this is contact dermatitis. So using the right makeup products is also important. As far as possible, if you ask me, less chemicals is better in this age group. They shouldn't, but if they are using your compacts or makeup removers and all, you have to keep these things, your brushes, your those cotton pads,
Yes.
or everything has to be clean. Your lipstick, ideally you shouldn't use more than 6 months, even if how expensive it is, you have to throw it.
How to throw it out.
So the makeup and all that,
No, but
it's
it's
very
right.
You should never sleep with makeup on your skin, especially eye makeup. To clean eye makeup, you need to use specific, micellar water or lightweight products, because the skin around the eyes is the thinnest in the body. Under eye skin is 0.5 millimeter thickness. So if you use harsh products, you're going to cause damage to these areas. So you have to be very careful about these things.
And not sharing your makeup as well.
Yes, hygiene is very, very important. Don't share your combs, your towels, your makeup brushes and your lipsticks, because you put it on your lip. You don't know what your friend has, what sort of infection. So do not share all these things. Absolutely no.
Now, another thing that I was coming to you with, it's a little embarrassing, but it is true. आपल्या भारतामध्ये गोरं असणं हे अजूनही खूप ॲज अ व्हर्च्यू बघितलं जातं. आपण बऱ्याच वेळा बोलताना असं बोलतो, नाही ऑल स्किन टाईप्स अँड ऑल स्किन कलर्स आर इक्वल, अँड पण कुठे ना कुठेतरी जेव्हा आपण मार्केटमध्ये एक फेअरनेस क्रीम लॉन्च करतो, म्हणजेच आपण हे सोसायटीला सांगतोय की समवेअर वी आर प्रमोटिंग फेअर स्किन.
So what I would say, my whole thing about it is that it's not about being fair, dark, wheatish. It's about having a skin which is blemish free, without uneven texture. I have this patient who's a supermodel and she's absolutely dark, but she has one tone from head to toe and she looks so beautiful. She is ebony dark. But that's what I'm saying. It's not about the color. It's about having the healthy skin, healthy glow on your skin, and that just doesn't come with products.
One skin all over.
Yes, without any blemishes, without any marks, without any spots. So your skin has to naturally glow, and that will come if your diet is good. You can hide with makeup, but if you are having a healthy lifestyle, if you are having a healthy diet, the natural glow comes. You don't need to put blush on. Your cheeks will look pink if you are healthy. So why do we say pink of health? Because when you are healthy, that's how you will do this. So your skin is a reflection of internal health. Your skin, hair, what you put inside is very, very important. And again, I want to stress on sleep. Very, very important, because the Gen Z is losing their sleep. They are not sleeping enough. They're all the time into, devices and late nights.
Yeah. Ma'am, 2 lines on bleaching your face and shaving your face.
Okay, so bleaching your face, if you have excessive hair growth, take treatment. If it's due to hormonal treatment, I would say laser hair removal is a good option to permanently reduce the hair. If you shave your hair on the facial area, see, shaving is you're taking away just the superficial hair. It's going to grow back in 2 to 3 days,
and in a denser way.
Yeah, it can get thicker with repeated shaving and all. You can cause cut and infections. Waxing on the face can also cause loosening of the skin. You can get boils or acne after waxing and all that. So basically, if you use a bleach, don't use it for more than 3 minutes. The chemical reaction is enough in 3 minutes. If you use 5-10 minutes, it's not going to do any additional benefit. In fact, your face will look white when you go out in the sun. And use very, very organic or those mild bleaches. At least I would say that keep your skin healthy rather than having to resort to all these treatments.
Ma'am, हे मुलींसाठी झालं. मुलांसाठी when they have to shave, then what is the skincare that can go after?
In boys, if you don't shave in the right manner, sometimes they have very coarse beard because of their hormonal changes in the body. So they can land up with folliculitis or that infection in this, or they can land up with a lot of inflammation and this. So don't use after shaving, because use a lightweight moisturizer or a sunscreen. If you have a problem skin, shave in 2 to 3 days, not every day. Another thing is clean your
Razor.
razors. Because many times you are reinfecting. If you've had acne boils and you've used the razor and then again you're reusing the same thing, you're again causing the infection.
So ma'am, with right way of shaving, did you mean the way the hair growth is, you should shave accordingly, or in the hygienic manner you said that, or?
See, hygienic manner, now if you say the method in which they have to shave, it's always in the direction of the hair follicle.
Correct.
But some people have really coarse hair which wouldn't this thing. So maybe that time they can do a little, in the opposite direction.
Yes.
And if you have long beard, first trim it and then use a razor.
Correct.
Don't immediately use a razor, because it's going to, all that hair is going to get caught in that.
Yes.
So use a trimmer, and suppose after shaving you're getting dermatitis, inflammation, then trim it and keep it short rather than shaving it every other day.
Correct. मॅम लास्ट टॉपिक, सॉरी आम्ही तुमचा थोडा आज वेळ घेतोय, पण ही टॉपिक स्किन आणि हेअर रिलेटेड एवढे आहेत, म्हणजे आमच्याकडे एवढे क्वेश्चन्स आले वेन वी सेड दॅट वी विल बी हॅव्हिंग अ कॉस्मेटॉलॉजिस्ट इन आवर चेअर, तर त्यांनी काही जे प्रश्न विचारले तेच आम्ही तुमच्याकडनं माहिती घेण्याचा प्रयत्न करतोय. सो प्लीज हॅव लिटिल मोर पेशन्स फॉर अस. मॅम, लास्ट, ब्लड प्युरिफायर्स.
Yeah, so that has been an age-old thing. People who have acne, if you take certain syrups or things which will purify your blood. So first and foremost, please understand, acne is not because of impure blood. Acne is a disease of oil glands because of hormones, environmental factors, etc., etc. So these so-called blood purifiers are not going to work. Second, these blood purifiers were found to be heavy in metals like arsenic and all that. So they have been banned in the outside countries. So it is very important that you don't give your children all these medicines, because it's not because of impure blood. Please have it clear.
मुलांना कुठलेही मेडिकेशन देण्याआधी एका मेडिकल प्रॉपर डॉक्टरचं इन्फॉर्मेशन घेतल्याशिवाय मला नाही वाटत सेल्फ मेडिकेशन इन टर्म्स ऑफ स्किन, हेअर, or any part of your body. I think it's better to take medical advice.
Yeah, so here one more mention I want to do. I get lot of these teenage boys who are hitting the gym and they're taking these protein powders
shakes. Yes.
Or shakes. So it's their gym person who has advised something, you take this or whatever. So be very careful about these, because excess protein can cause hair loss, excess protein can cause acne, excess protein can damage your kidneys. So it has to be regulated. So do not just take just because somebody has advised you that you start these protein, because they come up with lot of hair loss is hitting children quite early,
and premature graying too.
And premature graying, like by nowadays I'm seeing school kids come with lot of, the mothers come and say they are having this. Can be either genetic, but if it's not genetic, there are certain deficiencies like B12 deficiency, thyroid problems. They can also cause premature graying. So when we investigate these children and treat, we can have arrest of this and repigmentation of the hair as well. So it's important that you take help at the right time.
स्पीकिंग टू डॉग, मला एवढंच कळतंय की आपल्याकडे बरेच ऑप्शन्स अवेलेबल आहेत आणि वी हॅव मनी ऑल्सो. त्यामुळे डोक्यात विचार आला की आपण पहिले जाऊन ते इन्व्हेस्ट करून आपण घरी घेऊन येतो, पण विकत घ्यायच्या आधी फक्त एक थॉट, यांनी आपल्याला त्रास होणार आहे का, किंवा इंटरनली आपल्याला ह्याचा काही त्रास होणार आहे का, किंवा आपल्या फॅमिली डॉक्टरशी बोलून किंवा आपल्या डर्मेटॉलॉजिस्टशी बोलून, आपल्या कॉस्मेटॉलॉजिस्टशी बोलून आपण हा प्रोडक्ट वापरावा का, हा एक थॉट आपल्या टीनेजर्सचं आयुष्य बदलू शकतो. टू गिव्ह इट अ थॉट पेरेंट्स. डॉग, आज आम्ही तुमचा खूप वेळ घेतला. तुम्ही तुमच्या बिझी स्केड्यूलमधनं अगदी क्लिनिकवर थोडे पेशंट्स थांबवून आमच्याशी आज गप्पा मारायला आलात. बट डॉग, इट वॉज इन्साइटफुल. काही गोष्टी मी ऑल्सो ॲज अ पेरेंट, आय हॅव अ डॉटर, शी इज 15 years old, आणि काही गोष्टी माझ्यासुद्धा एस्पेशली रिलेटेड टू एक्सफोलिएटिंग अँड स्क्रबिंग, मी सुद्धा असं विचार करत होते की बहुतेक या गोष्टी युजफुल आहेत, पण त्याच्याने काय स्किन डॅमेज होतं आज हे तुमच्याशी बोलताना मला कळलेलं आहे. सो आय एम गोइंग टू मेक माय चेंजेस अँड आय एम शुअर आवर पेरेंट्स आर गोइंग टू डू द सेम. डॉग, थँक यू फॉर कमिंग, अँड बिफोर यू लीव, a little gift from our end.
Thank you so much.
May this jade give you lots of prosperity.
Thank you.
Doc, thanks again. A heartfelt thank you for coming.
My pleasure.
On our show today. Beauty is skin deep. And it's not just about being good looking. Life is all about having that bright mind, a beautiful heart, and a kind soul. On that note, signing off from today's episode. लेकिन हम दोबारा मिलेंगे आपसे एक नए कॉन्वर्सेशन के साथ, एक नई इंफॉर्मेशन के साथ. Till then, keep watching In Our Teens. And do not forget to like, share, and subscribe. Ciao.